morning, everyone. Welcome back to our Wednesday Wellness webinar. For today's topic, we have influenza. I am Maricolin Casabuena, your speaker for today. For our discussion outline, we have the overview, the symptoms, causes, risk factors, diagnosis, treatment, and how influenza is being prevented. Influenza, it is a viral infection that attacks your respiratory system, especially your nose, throat, and lungs. It is also commonly called the flu. So we have this famous influenza pandemic that swept the world back between 1918 and 1919. So alam naman natin lahat kung ano ito. So it is commonly called as the Spanish flu. So by that time, marami din ang namatay. So today, we are also experiencing influenza kasi nga malamig yung ating panahon. Kaya marami ngayon ang nagkakasakit. So what are the symptoms of influenza? The patient will experience fever. Usually 38 to 39 degrees yung pinakamataas na temp reading ng isang pasyente. Also, nagkakaroon din sila ng aching muscles or mga body aches. Chills and sweats. Ang pasyente nagkakaroon din sila ng headache. Ang mga pain scale nila usually is 7 to 8 or 9/10. Then, meron silang persistent dry cough, shortness of breath, fatigue, nagkakasipon, may sore throat, eye pain, vomiting, and diarrhea. But these symptoms vary from person to person. So what are the causes of this? So influenza, nakukuha ito via inhalation and touching. So if an infected person cough, sneeze, or talks, so especially ang isang taong mababang immune system nila, madali silang mahahawa ng influenza. And if the person touches objects na natouch ng isang infected person at natouch niya ang kanyang eyes, nose, and mouth, kasi yun yung mga modes of transmission, so ang tendency is magkakaroon din sila ng influenza. So that's why it is very much important that we have to keep our hands clean always. So maghugas po tayo and mag-sanitize. So what are the risk factors of this? We have age. Usually children who are 6 months and 5 years older, and then adults or senior citizen adults already, ages 60 to 65. Those people who are living or working condition. So yung nakatira sa mga congested areas, yung mga dikit-dikit ang bahay, so very risky po sa kanila yung, and those people who are working in the hospital settings. So for those people also na mga weakened ng immune system, these are the people who have cancers, nag-undergo sila ng chemo, and then those are people na may karoon sila ng HIV or AIDS. So commonly very weakened ang immune system nila. That's why before pandemic, if we notice, those cancer patients na katatapos lang ng chemo, they do cover face mask kasi para hindi po sila ma-infect po ng any viruses. So for the pregnant women, very risky ito for their second and third trimesters. Also 2 weeks after they gave birth. Risky din ito sa mga taong obese, and for those who have chronic illnesses like asthma, diabetes, heart diseases. So how it is being diagnosed? It is being diagnosed by a face-to-face consultation or online consultation, because ito na ngayon yung bago nating mode of consultation with the doctor because we are still in pandemic. So through that, it is very much important ang doctor's recommendation. That's why the clinic team in this company is requiring employees to have a doctor's consultation, because we do refer doon sa recommendations ng doctor if ano ang gagawin sa pasyente, especially yung influenza symptoms is also like with COVID-like symptoms. Also, another diagnosis is for the RT-PCR. So para malalaman natin if ang patient is meron lang ba siyang influenza or systemic viral illness or upper respiratory tract infection, he or she must undergo the RT-PCR test. So through that test, malalaman natin whether the patient is positive or negative. So kung negative, very good. Kung positive naman, the patient will undergo quarantine. So depende yan sa recommendation ni barangay or ni doctor if it is 10 days or 14 days quarantine. We also have the following treatment. So home instructions will be given. Like for example, if ang patient is having fever, usually nakikita namin sa mga medical certificates na the doctor will give them home instructions like increased fluid intake. It is one way of preventing dehydration, and then rest. Binibigyan dun ng doctor na may mga 7 days, 10 days, or 14 days. This is to get more sleep to help your immune system fight infection. And for the medications naman, the doctor usually give paracetamol like Biogesic, Tempra Forte, Decolgen, and for pain naman, the doctor is giving the patient mefenamic acid, for instance. So what are the flu prevention tips? One way to prevent this infection is to have a vaccine. So it is done yearly. Itong vaccine na to is one way to prevent also mode of transmission. So we have to keep our hands clean with soap and water always. And then after, we have to sanitize. When someone with infection sneezes or cough, you have to cover your mouth para hindi rin mahawa yung ibang tao. So don't just touch anything without washing your hands after. Also, smiling and laughter can help boost your immune system as well. Eating healthy and balanced diet is also one way of strengthening your immune system. Exercise as well to recover from illness. And if you are already infected, you have to stay at home. It is one way of stop spreading the viruses. And also, we have to follow what the doctor's recommendation is like. Yung sinabi ko kanina, na have enough rest and take your medications as what the doctor have told you. So that ends my presentation. Always remember to take care of your health, have enough sleep always, take your vitamins daily, and exercise. That ends my presentation again, and thank you guys for listening. Have a great day, take care, and God bless. Bye!